This week, Munich is the venue of the world's largest scientific meeting to combat HIV, the virus that causes AIDS. More than 10,000 participants are expected to attend the 25th International AIDS Conference. Doctors, health experts and activists from more than 175 countries invited by the International AIDS Society will discuss how the pathogen HIV and the acquired immuno-deficiency syndrome, AIDS, can be further contained. It is the first time in 3 decades that the conference is being held in Germany. The experts gathered in Berlin in 1993. Here's a report.
New data by UNAIDS reveals that over 30 million people living with HIV are now on treatment. This is a landmark public health achievement that has also seen AIDS-related deaths halve since 2010, from more than 1 million to 630,000 in 2023. But this is far above the 2025 target of 250,000 AIDS-related deaths. And there are still an estimated 1.3 million new HIV infections in 2023. Approximately half of the people who acquired HIV last year were living in Eastern and Southern Africa and Western and Central Africa.
I am an orphan. I was the only one to take treatment every day, and I took the treatment without stopping. I live with the HIV virus, and this since I was born.
Decades into the epidemic, the number for AIDS patients are still awful. In a report published on July 22nd, UNAIDS, the United Nations agency tasked with dealing with the disease, says that 40 million people around the world are now infected. This snapshot of the epidemic is the background against which the 25th International AIDS Conference opens in Munich. Though these gatherings are no longer the councils of war about how best to proceed that they were in the epidemic's early days. For matters of grand strategy in the fight against HIV are now pretty much settled.
Making sure that we really understand the data, that we know where there are gaps, where are we not reaching communities. And so we know, for example, in Africa, we've seen tremendous progress in East Africa. We've seen less progress in West and Central Africa. So as we think about controlling the epidemic, it's not equal. It's not equal across countries. It's not equal across entire regions. And so we have to really focus on who is not being reached.
Sub-Saharan Africa remains home to almost half of people living with HIV who have no treatment. Access is especially low among children. Head of UNAIDS says it is urgent that game-changing technology such as long-acting drugs to treat or prevent HIV, already available in places such as the US, be shared immediately with developing countries.
I think Gilead has an opportunity to take us closer to ending AIDS as a public health threat. They can make history with this, not only by putting it out there as a preventive tool for everyone who needs it all over the world through generic production, but also licensing it for everything, not just for prevention, but also for treatment.
We have all of the tools, the technology right now to end the epidemic as a global health threat. And I think the opportunity, when you look at political leadership, to actually achieve those goals by 2030, a short 5 years from now, if we could, looking at those countries that have been most severely impacted, and there are countries in Africa that have now reached 95% of the people that need access to treatment. They have achieved those goals. So thinking of how we're getting closer to the finish line.
The forum is important for researchers, medics and activists from around the world to meet with each other. Organizers of the conference hope that it will be an opportunity to remind politicians and voters in wealthy countries where AIDS has pretty much dropped off the radar, that the fight continues in many of the world's poorer parts, and that money is the sinews of war against viral enemies as much as human ones. Africa Bureau, WION World is One.
For all the latest news, download the WION app and subscribe to our YouTube channel.